infrastructure and also biobank for research work in medical sector. We want to make the biobank in the South Asia region. I will talk few minutes on health infrastructure of Bangladesh, opportunities for BSMMU to lead translational research in the region. Opportunities for BSMMU to lead an example in South Asia. Tuberculosis, we had a lot of success in our country, and before that, we can also say that in the eradication of polio, we are at the end of eradication of filariasis and Kala-Jor, and also in our EPI program, the expanded program of immunization. It is the successful in the world, I think so, and also vitamin A in an EPI program causing a less number of night blind people, and also we are giving the spectacle to the farmer during their cultivation, and there are less number of corneal ulcer. So all these are the innovations which can be performed in our country. And we have a lot of different infrastructure, national, district level, upazila level, community clinic level. These are the infrastructure in our country. At the tertiary level, in the division, there are some teaching hospitals, specialized hospitals, medical colleges, there is some institutes. And in the secondary level, in the districts, we get district hospital, general hospitals, and also many medical colleges are there in some of the districts. In the primary level of our health sector, we have upazila health complexes, and there is also Union Health and Family Welfare Center, there are Mother and Child Welfare Center, MCWC, and also the dream of our Honorable Prime Minister, which is now in the world, it is well taken as the Sheikh Hasina initiative, the community clinic for 6,000 population, each one, and about 16,000 community clinic are there in Bangladesh. So in this community clinic, about 30 drugs, including insulin and metformin, that is being given to the patient free of cost. And in our country, there are a lot of people suffers from malignancy, lower respiratory infection, chronic obstructive pulmonary disease, ischemic heart disease, cerebrovascular disease, preterm birth complications, tuberculosis, neonatal encephalopathy, and so forth. And we are also always proud of some of our specialists and the researchers. Kadri, you all know, he has the paper on feasibility and effectiveness of the oral cholera vaccine in the urban cholera endemic setting in Bangladesh, a cluster randomized non-blinded trial, and also Shah Muhammad Farooq and Deputy Shirajul Islam, they have also innovation for universal health coverage. They also given, they are the proud of our Bangladeshi population. Then, what we can, Asia region, South Asia region, we can make a successful research work through this biobank. And you have already mentioned about the finance, you have already mentioned about the regulatory body. I think we have the infrastructure. If we get the finance, we have the regulatory body, Bangladesh Medical and Dental Council, and also in future, AI will be another effective thing to help in this, in the case of the biobank formation in Bangladesh. So I think if you have this type of support for this South Asia region, Bangladesh can lead all the state of South Asia region, so that we can make a successful biobank in Bangladesh, and in future we will work together. Thanks for your initiation, and this is my university, and I hope there is the super specialized hospital which was inaugurated by our Honorable Prime Minister. We hope we will work together and we will make this type of initiative a successful one. Thank you very much for patience here.
In this slide, you can see the position of a biobank. We really collect samples from patients. First of all, we take consent from the patient. We collect the associated data, and then we collect the biospecimen. These biospecimen and the data are processed and stored in the biobank.
We have, as you know from our previous speakers, that there are so many basic faculty members and also the faculties with enormous potentiality in clinical research. If we establish a regional biobank at the center of this menu, it helps for the molecular and the translational research. Research outcome of this MMU, here we see that mainly we make collaboration. We have collaboration with different institutes and also
Bangabandhu Sheikh Mujib Medical University. Now they can fly if you can help us by giving some scope for establishing biobank. Thank you very much, Dr. Arman, for initiation of this type of work.
So thank you very much, everybody.
Thank you. Thank you.
Good night.
Good night.
Okay, bye.
Bye.
Thank you.